It was around 8:45 p.m. when the doorbell rang. I was in my room and my dad went to answer the door. I could vaguely hear him say something as he rushed out of the house. Confused, I called him. After a few rings, he picked up and I realized that he was crying. I had never seen my dad cry. And then he said something that will haunt me forever. Raghav is gone. My younger brother Raghav was my best friend. On 6 January 2019, we lost him to suicide. He was only 18 years old. It was very sudden and none of us saw it coming. We were completely blindsided by it. In fact, just 6 days prior to this, on New Year's Eve, he was dancing right next to me and there is a video of us dancing together. If you see that video, you will not believe that it's the same person who decided to end his life just 6 days later. This goes to show that suicide doesn't have a type or a face. It can look like anything in anyone, even young, happy, dancing men. Sadly, my story is not unique. This is the story of more than 4 million families who lose a father, a mother, a brother, a sister, or a friend to suicide. According to WHO, suicide is the second leading cause of death among young adults globally. We lose someone to suicide every 40 seconds. And it's predicted that by the end of this year, that number will go down to every 20 seconds. Imagine losing someone to suicide every 20 seconds. Even coming to my own country, India, according to the latest report by NCRB, India reported an average of 381 deaths daily, deaths by suicide on a daily basis in 2019. We lost more than 90,000 young adults to suicide in the year 2019. These numbers are staggering and they're only increasing, especially due to the pandemic and the crisis that we're facing this year in 2020. Even coming to those who are left behind, life is never the same. It took a long time for me and my family to even come to terms with what had happened to us. We were completely broken. I felt so helpless, but then I asked myself, am I? This is when I decided to do something about this, especially after seeing the staggering statistics. I dove deep into research and I found a lot of disturbing facts. First and foremost, our country did not have a national helpline number for suicide prevention. This is the most basic thing that any country can and should have. So I decided to go for this cause. As a change maker from Change.org's flagship program She Creates Change, I launched a petition in July last year asking the government to launch a national helpline number for suicide prevention in India. My petition has received more than 400,000 signatures, and this finally led to the creation of the Kiran Mental Health Rehabilitation Helpline Number, which was launched by the Ministry of Social Justice and Empowerment on 7 September 2020. This is a huge win, not just for me, but the entire nation. We have finally taken a step towards the right direction. Although this helpline number has only been functional for a couple of days now, it has received a huge number of calls. And people have reached out to me, congratulating me and thanking me because they have finally found solace in the fact that there is a 24/7 helpline number out there that they can reach out to. But we still have a long way to go. I have realized one thing, that policymakers have a huge role to play when it comes to suicide prevention. First and foremost, setting up a helpline number is very important to reduce the number of suicides. These numbers, they act as safety nets and the first line of intervention in order to provide immediate support to people who are at risk and also direct them to mental health professionals within their area. But just setting up a helpline number is not enough. More needs to be done. We need to make sure that these helpline numbers function properly and that the quality is maintained. Lawmakers also play a very important role when it comes to suicide prevention. Creating laws which reduce access to lethal methods is key. In fact, it is one of the most prominent prevention approaches and can be unleashed across countries. One of the biggest examples of this is Sri Lanka. Over a span of 27 years, starting from mid-1980s, Sri Lanka banned some of the most lethal pesticides in the country. Before the ban, it had one of the highest rates of suicide, and these suicides were attributed to the pesticides. Once these pesticides were banned, the rates of suicides, they reduced drastically. Another example of this is Hawaii. It implemented the red flag law, which allows doctors, police, family members, and mental health providers to file a petition in court if they believe that a person is at an imminent risk of harming themselves or others. This goes to show that implementing such laws can also help in reducing suicides. Another thing that policymakers can do is make sure that the gatekeeper training is made compulsory across countries. Gatekeepers also play a very important role when it comes to suicide prevention. They can recognize early warning signs, give proper interventions, and provide access to proper mental health services. Governments and countries can also appoint a minister as head of mental health and well-being. They can also create an emergency task force consisting of public health experts that create and execute evidence-based interventions. We know that UK has appointed a Minister for Suicide Prevention in 2019, and they have seen results. If UK can do it, so can we. Finally, it is also very important that we implement suicide prevention policies. Countries that have implemented the suicide prevention policy, they have seen that the rates of suicides have decreased. So these are some evidence-backed methods and recommendations that we can take into account and make sure that we reduce the number of suicides. Now, these are just some of the many steps that policymakers across the globe can take in order to raise awareness and also get tangible outcomes. Now, coming to QPR Gatekeeper training. What is the QPR Gatekeeper training that I'm going on and on about? Well, QPR stands for Question, Persuade, Refer. It is an online gatekeeper training which takes about 60 minutes to complete. You can either finish it in one go, but we recommend that you take it at your own pace. Some of the components of the QPR Gatekeeper training include how to question someone about suicide, how to persuade them to seek professional help if they are in distress, and how to refer them to proper resources. We also teach you about some of the warning signs of suicide. Also, what causes suicidal behavior? What to do if you are in crisis, and how to help a friend if they are in crisis. The thing is that you don't have to be a mental health professional to take the QPR training. Anyone can be a gatekeeper. It could be a parent, a friend, a teacher, a sibling, or a coach. This goes to show that everyone is capable of saving a life. All of us. Finally, I would just like to say that we have a huge responsibility. All policymakers, parents, teachers, friends, and relatives, they need to give immediate attention to this very, very serious issue. Suicide is a global pandemic that no one is talking about. And it is our responsibility to raise awareness about the same, to start conversations, and not just start those conversations, but continue them and do something about them. It is also up to us to spread this really simple yet life-saving message that suicides are preventable. Thank you so much.